The topic is describe the physiological basis of hemostasis and anticoagulants. Now, why the code PY? PY stands for physiology in the competency-based curriculum of the National Medical Commission. There are codes for anatomy, codes for biochemistry. Biochemistry for BI. Physiology is PY. 2 is the second topic. The first topic being general physiology. Second topic being 2 year being blood. And 8 is the 8th competency in blood, which is described describe the physiological basis of hemostasis. Now, hemostasis is due to the role of what is hemostasis? Hemostasis is prevention of blood loss, prevention of even a tendency to lose blood, prevention of even the onset of platelet activity and blood coagulant factor activity, even at the trivialest of bleed, that is denudation of the endothelium and exposure of the subendothelial coat. So in the trivialest of bleed, there is a mechanism comes to the fore, and this prevents, if it's a trivialest of bleed, it is subtle, the involvement of the platelets, blood vessel, clotting factors, and fibrous tissue is subtle. But if it is a stupendous injury, then the platelet, there is a breach to the vessel wall, damaged vessel wall. There is a damaged vessel wall, then the mechanism is all the more, the mechanism for prevention of bleeding is all the more accentuated. Now, platelets have receptors. These receptors, the name of the receptor is glycoprotein 1B. And the endothelial cell and the platelets secrete von Willebrand factor. The platelets get their von Willebrand factor from their precursor megakaryocytes. The megakaryocytes are the ones that have von Willebrand factor. And as the platelets are pinched out from megakaryocytes, they have the von Willebrand factor. They have the von Willebrand factor, which on activation and degranulation is secreted into the blood. So, on attachment of the glycoprotein 1B receptor to von Willebrand factor, the platelet changes its shape and it becomes sticky by the secretion of ADP in particular, adenosine diphosphate, and it gets adhered to the damaged vessel wall and it becomes sticky to other platelets, and the other platelets get activated and they degranulate in the presence of calcium. Calcium is required for degranulation of platelets. So this degranulation, the granules will release during degranulation ADP, platelet activation factor, which involves activation of fibrous tissue to form a permanent plug from a temporary hemostatic, from a temporary platelet plug, a permanent platelet plug. And it also releases thromboxane A2. Thromboxane A2 acts on smaller vessels to cause vasoconstriction. And the sticky platelets cause movement, recruitment of more platelets and aggregation. So there is adhesion, there is adhesion, adhesion, activation, and aggregation of platelets. Then there is clot contraction, wherein there is contraction of contractile proteins. Don't have to mention the first two. Third one is thrombosthenin. It's a contractile protein. In the presence of calcium, the first and the second contractile proteins are actin and myosin. They need calcium to contract and thereby cause clot retraction and conversion of the temporary hemostatic plug to a permanent hemostatic. Now, what is the involvement of blood vessels? They undergo myogenic spasm. Myogenic spasm of the tunica media, the smooth muscle of the blood vessel wall. They because of the insult from the injury, the smooth muscle wall undergoes spasm, and the autocoid factors, that are local factors are derived, which are derived from, which enhance hemostasis from platelets, derived from platelets, from endothelium, and from the injured tissue. Neurogenic reflexes set in between from minutes to hours for platelet plug formation and for clot formation. Neurogenic reflexes come to the fore because of sensory nerve damage and pain nerve damage. Thromboxane A2 from platelets act, as said earlier, on smaller vessel to cause constriction. Thromboxane A2 from platelets for smaller vessel constriction, vasoconstriction, and just the blood and no clot in minor vascular holes. There's no clotting taking place when the damage is done to, when the damage is of minor holes in the vascular system. There is just the platelet plug and no clot formation. Now, platelets, coming back to platelets, they have contractile proteins, actin, myosin, and thrombosthenin. And the ion required is the bivalent ion, calcium. And the platelets put out fibrin stabilizing factor. The fibrin stabilizing factor causes the fibrin to become into a fibrin thread, and the platelets put out growth factor because the platelets put out growth factor to cause growth of fibrous tissue, and the cell membrane of platelets have glycoprotein and phospholipids. Fibrin attachment leads to permanent hemostatic plug. Platelets form additional endothelial membrane. When the endothelium is damaged, the membrane is lost, and this causes platelet adhesion. And platelets provide the additional membrane, they provide membrane to the lost membrane of the endothelium. And when there is less platelet in the circulation, normal platelet count is 1.5 lakh to 4.5 lakh, and when it becomes less than 20,000 per millimeter cube or microliter or microliter, what happens is bleed under the skin. It leads to petechiae. It leads to petechiae, and bleed in the tissues leads to again punctate bleeds, small tiny bleeds under the skin and in the tissue, wherever the blood vessels are, capillaries, they lead to what is known as petechiae. The most salient thing from this green from it converts fibrin to fibrin. Fibrin stable fibrin which connects the platelets to form the permanent hemostatic feedback from bin converting factors with clot stabilizing factor to active clot stabilizing factor or fibrin stabilizing factor, active fibrin stabilizing factor, stable fibrin which helps the form of permanent hemostatic. If the injury is trivial, as said earlier, then intrinsic pathway, intrinsic means in relation to the blood vessel. The blood vessel is not breached, but what could be lost is endothelium, endothelium lining the blood vessel. What could be exposed is the subendothelial collagen, and factor 12 is converted to factor 12A by high molecular weight kinase molecule. Factor 12A is attached to high molecular weight kinase and pre-callicrine, which is the feedback to callicrine. 11 to 11A. 11A is attached to high molecular weight kinase molecule, and factor 9 is converted to 9A, and factor 7 is converted to factor 8, intrinsic factor 8, anti-hemophilic factor, anti-hemophilic globulin is converted to factor 8A by thrombin under the influence of calcium and is in the blood vessel, and that is the intrinsic pathway inside the blood vessel. The extrinsic pathway is brought about by factor 12 in the tissue, and it gets the injury activates factor 12. There is the tissue factor from the tissue, from the cell membrane. There is the tissue factor where 7A gets activated. Factor 7 gets attached to tissue factor, and there's a complex tissue factor 7, activated factor 7, and calcium This converts factor 10 to 10A. So factor 10A to 10A is the pivot. It plays a pivotal role. It comes from the intrinsic pathway to factor 9A, factor 8A, and calcium. And from the extrinsic pathway from the complex to tissue factor, factor 7A, and calcium. And this factor 10A, factor 5, and calcium convert prothrombin to thrombin. And there is a feedback. Thrombin is involved. Major step is this formation of this thrombin from prothrombin by the action of prothrombinase, which is factor 10A, factor 5A, and calcium. And thrombin is formed and very significant. And this thrombin converts fibrinogen to fibrin monomers. And fibrin thrombin also acts on fibrin stabilizing factor, converts to activated fibrin stabilizing factor, formation of stable fibrin, which converts the temporary hemostatic plug to permanent hemostatic plug. This is the common pathway. The intrinsic pathway. The extrinsic pathway means that the initiation of blood coagulation is occurring outside the blood vessel, the surrounding. And for that, factor 7, the injury causes activation of factor 7. It gets attached to tissue factor. Calcium is involved, and it converts 10 to 10A, factor 10 to 10. Now, clot formation. How does clot form in the blood vessel? Bleeding severe vessel. And first step is that platelets agglutinate to the endothelium, maybe due to lack of endothelial surfaces having negative charges, lack of the negative charges. And then you have fibrin appears in the clot, and the fibrin clot forms, and this is lot of traction taking place thanks to the peptide proteins, actin myosin, and thrombosthenin in the presence of clot formation. Clot initiation occurs in major trauma in 15 to 20 seconds. Rapid, because both blood trauma and tissue trauma are involved. Both intrinsic pathway and extrinsic pathway are initiated. So the clot initiation occurs in 15 to 20 seconds. Minor trauma, it takes 1 to 2 minutes for clotting to get initiated. Initiators of clotting are from the vessel wall, the platelets, blood proteins, and clot filling in 3 to 6 minutes. The distal part of the tissue of the blood vessel wall is filled with clot in 3 to 6 minutes. Clot retraction in 20 to 60 minutes, and platelets are involved in clot retraction. Small clot invaded by fibrous tissue takes place in hours. Small clot invaded by this fibrous tissue growth occurs due to growth factor released by platelets. Large clots in tissues have enzymes, and these enzymes dissolve the clot. And these are the clotting factors: fibrinogen, tissue factor, calcium is factor 4, calcium factor 5 is proaxanoline, bile factor, factor 7 extrinsic pathway, 7 is serum prothrombin conversion accelerators. And factor 8 is anti-hemophilic factor, anti-hemophilic globulin intrinsic pathway. This is the intrinsic pathway. Plasma thromboplastin, not tissue thromboplastin is factor 7, and factor 10 is Stuart power factor. And factor 11 is plasma thromboplastin antecedent anti-hemophilic factor. Factor 12 is Ekman factor. Factor 13 is fibrin stabilizing factor. Precalcium Fletcher factor. High molecular weight kininogenous Fitzgerald factor. And platelets are included as clotting factors. This prothrombin activator is along with calcium. Prothrombinase in the previous slides. Prothrombinase and converts thrombin to it converts thrombin converts fibrinogen to fibrin. Fibrin fibers, they cause thrombin activated fibrin factor, fibrin cross-linked fibrin fibers like thrombin, activated fibrin stabilizing factor, activated thrombin stabilizing, activated fibrin stabilizing factor. Causes cross-link of fibrin fibers. Schema for conversion of prothrombin to thrombin and polymerization of fibrinogen to fibrin fibers. Prothrombin activator along with calcium thrombin, and thrombin causes conversion of fibrinogen to fibrin along with calcium fibrin fibers. Thrombin causes activated fibrin stabilizing factor, which causes cross-linked fibrin fibers. Procoagulants versus anticoagulants. Anticoagulants are, these are the procoagulants already mentioned again. Fibrinogen, prothrombin, tissue factor, calcium, factor 5, factor 7, tissue thromboplastin factor, factor 8, anti-hemophilic factor, the lack of which can cause hemophilia, which is X-linked disorder, and factor 9, plasma factor, anti-hemophilic factor 10, Stuart power factor, factor 11, all procoagulants, factor 13, fibrin stabilizing factor, precalcium factor, high molecular weight kininogen factor, platelets are again, these are procoagulants. All the procoagulants pathways show here. This anticoagulants. There's no factor 6. No factor 6. The intrinsic pathway. For initiating blood clotting. Blood trauma is important. Contact with coalition. Factor 12 to activated factor 12 way, 11 to 9 to 90, and then factor 8 to 88. Calcium is involved, activated factor 8, 9 is involved. Platelet phospholipid. Platelet phospholipid. It causes thrombin. Here, calcium comes. Prothrombin activator. Phospholipid platelet phospholipid once again. Prothrombin, thrombin converts fibrin, and fibrin stabilizing factor 13 converts fibrin to anticoagulant. The smoothness of endothelial cells prevents glycocalyx prevents formation of cells, blood vessels, balanced by anticoagulants. Thrombomodulin binds to thrombin and thrombin activity by prevents formation of fibrin. So, balancing the procoagulant activity of the proteins in the blood. Thank you.